Welcome to another podcast of Plastic Surgery 90210. My name is Ariel and we're here again with Dr. Katzen.
Hello, thanks for having me.
Hi, thank you so much. So we really want to focus on silicone injections removal, and recently we've been scrolling through YouTube and seeing a lot of influencers out there saying, you know, I got these buttock injections and I'm fine. You guys will be fine too. And it's just so bad because they're influencing all these young people out there, and they're like, who's your pumper? They call it a pumper, and they want to go to the same person.
Yeah, it's really sad. I mean, it just really depends who you want to believe. You know, influencers or medical doctors and surgeons that deal with the catastrophic and devastating consequences of injections. You know, I daily see patients in the office, many patients for silicone injection complications like dead skin, infections, migration, all these other associated medical problems. So, you know, at the end of the day, it just depends, you know, who you want to believe. Influencers or doctors that are treating patients.
Right, and it frustrates me because it's like these people are maybe 2 years or 4 years out and they don't see the complications yet. You know, and they're not always honest about the symptoms that they're feeling because it's not the glorious side of being an influencer. They don't want to talk about how their skin is painful and they're having changes and it hurts to sit down. You know, and all these people are like, first of all, they're easily influenced. And they don't always know how to do the proper research, and then we see them like 8 to 10 years later and their lives have been changed forever.
Sure. We have patients that can't sit down, they can't walk because of these injections. We have a couple of patients who have had kidney failure and are on transplant lists because of these injections. Patients with dead skin. So, I mean, these are the real complications of injections. So, I mean, if you want to play that game, I don't suggest it at all. I'm not endorsing it at all. And it is a game. It's a game of Russian roulette of when you're going to have problems with those injections.
Not even if, it's when.
It's when. It's when. Sometimes it's, you know, on the table when they're injecting you, people die. You hear about that in the news all the time. And then you can hear about those consequences where, you know, I had an accident, I was in a car accident, or I fell down the stairs and my injections got infected, and then I wound up in the hospital for a couple of months.
I mean, let's explain the patient that you saw recently where it's like she fell down the stairs, and what happened next?
So a patient's from the East Coast, and everything was doing fine. She had injections and she was going about her life. She was very happy, and 8-10 years go by, and then she fell down the stairs. And from that trauma to her buttock, the silicone got dislodged, and then the dislodged silicone got infected, and she's been to the hospital many times. Most of the doctors she sees don't know what to do because basically the entire buttock on both sides, all that skin is dead.
And there's open wounds.
There are open wounds, leaking pus, and silicone. And those are the consequences of silicone. So if you want to believe your influencers and say, oh yeah, it's fine, it's worth it, you know, I don't suggest it.
Yeah, and another thing that I hear some influencers saying, or some people on the internet saying, is, oh, you get silicone implants, it's the same thing as silicone injections. No, it's not. One of them is illegal.
Yeah, completely different. I mean, silicone breast implants studied by our US FDA, they are wrapped in an envelope. Okay, the silicone, it's not even the same type of silicone. Okay, the silicone that's being injected is purchased at Home Depot, purchased at Lowe's. It is not medical grade, and it's not in a container. It's on the syringe being injected in hotel rooms and basements.
Usually when you walk into that situation, it seems suspicious.
Absolutely. I mean, think about it. If I were having something injected, I would want to be absolutely sure it's FDA approved, and I'd want to be absolutely sure it's done by a doctor.
Right, and people have had cosmetologists and nurses lie to them and say that they were injecting collagen, injecting Sculptra, but it ended up being a lie because we see them later on and we do the MRI and we see the product in there. Can you explain to us how we know the difference when we're doing that MRI?
Sure. So at the end of the day, the only thing that's inside your body is what the injector injected, and they know. The rest of us don't really know until we sort of take it out or it leaks out. So, they can tell you one thing, but what they're injecting can be totally different as they take your money and disappear. All right. So what we do is we get an MRI. The MRI tells us how much product was injected and then also where the product is. So the product can be just underneath the skin and the fat, or it can be even deeper in the muscle. So sometimes the injectors, they'll inject the fat. Sometimes the injectors will inject the muscle. And then the position of that substance really dictates as to what we do next to how to get rid of it.
And there's no really best case scenario for getting silicone injections, but getting it into the muscle, don't do it
from the get-go. Yeah.
But getting it into the muscle does seem to be worse because you're left with less options for removal.
Correct. So usually when it's in the muscle, the injector has to go deeper, and they go through the skin, through the muscle. Luckily, they don't hit the major blood vessels in there. Sometimes they do, and the patients bleed to death. But they go deep into the muscle. So when it's in the fat, sometimes we can get it out with suction. When it's in the muscle, then we're sort of dictated into making the incision.
And what he's saying is the suction would be the closed technique.
Yes.
And the incision would be the open technique. And those are the two options that Dr. Katzen offers. Yeah. Not everyone offers both techniques.
Correct.
And you spent 20 years perfecting this closed technique.
Yeah.
Can you talk about that?
Yeah. So at first, when we started taking out the silicone a long time ago, we would try to take it out conservatively with the least incisions. So to do that, we would try liposuction. And liposuction does not work for silicone removal. Why? Well, the tissue around the silicone is really, really hard. It's really, really scarred tissue. Second problem is the silicone balls are pretty large. They're like as big as my thumbnail, so pretty large. So the first thing to do is you got to find the stuff. So in the operating room, you got to find the stuff. And to do that, we perfected this technique where we use the ultrasound live during the surgery. Then we inject this tumescent solution, which helps put all the buttock into solution. And then step number 3, we can come in with the vaser to help dissolve all the scar tissue. And that allows access when we come in with our cannulas, our straws, to suck out the silicone. And the silicone straws are pretty large. They're custom made for us. They are not liposuction cannulas. Liposuction cannulas are very small. We're sucking out little bits of fat, but we use these larger bore, these large caliber, large diameter suction cannulas to remove this scar tissue and the silicone.
And that is the closed technique.
That's
ultrasound guided vaser assisted silicone suction. Yep. And then your open technique. Let's talk a little bit about that.
Yeah, the open technique is an incision that we make to gain access to the area of silicone impregnation. That can be anywhere on the body. And sometimes you can't do the suction technique in certain body parts, and you have to do the open technique. Like on the lips. On the lips, I do the open technique almost all the time. If we have silicone that's injected underneath the eyelids here, I'm going to do the open technique because the suction technique is not going to work, and it's too delicate in that area. For the cheek area, also typically I'm going to be doing the open technique through a facelift incision there, or sometimes inside the mouth. So some body part areas, like on the breast, typically we're going to be using an open technique. So some parts we can do suction, some parts we have to do open, some parts we can do suction or open.
Yeah, and I just want to kind of explain to a normal person what happens during these silicone injections, and you could interject if I say anything wrong, but from my understanding, they take the silicone, the liquid silicone, they inject it, and scar tissue grows around your butt. It capsulates, so really your butt's not getting bigger because your butt's just bigger with fat. It's all full of scar tissue. And then these capsules of silicone can migrate throughout your body. We've seen it in the labia, we've seen it in the thighs, all the way down to the ankles, all the way down to the toes where you've removed it. And it can move anywhere. It seems to defy gravity sometimes because we see it go up the back too.
Exactly.
And it's so scary.
Yep, absolutely. So, I mean, it's rolling the dice. It's a big gamble. The buttock that you're getting has some product in it, but a lot of our patients will tell us, I only had one session and the vial was only that big, and their buttock's like this big. And their buttock grew that big, not overnight, but over the course of 6 to 8 months. But that's because all that scar tissue is building up. It's not that the silicone or whatever has been injected grows. There's no way it can grow. It's inert. It doesn't grow on the shelf, right? It grows grows. It doesn't. It just sits in your body. But what does grow is the scar tissue around it. So at first you have the stuff that's injected and you make a little scar tissue around it. And then as more trauma and movement and years go by, you get more scar tissue. And like a pearl, the scar tissue just gets thicker and thicker and thicker and thicker.
And for those of you that don't know, this scar tissue is not soft. It doesn't feel like a natural buttock. We do a hardness scale while we're in the operating room to see, like, compared to a normal buttock that's full of like fat and some, you know, muscle naturally. And like some of these buttocks are like on the scale of 9, feeling like concrete.
Yeah, hard as a rock.
Yeah.
And if you can imagine, just if the buttock was that hard, like a bowling ball, and really, really hard, imagine just sitting on that and trying to lay on that and sitting in a car, extremely painful. So, I mean, these are things you really need to consider before, not after, before you think about buttock injections.
And a lot of the public will see the glorious side of these results, possibly. You know, there's a lot of things out there. There's Photoshop, there's like editing, there's blurring of things, and you just are not always getting the full story. So please make sure to do your research. And actually, for the month of February, you are offering free consults for silicone removal patients.
Yeah.
Because it's so important. And you want to just talk about that?
Yeah, so I mean, if you've had silicone injections, I would suggest you get it at least evaluated by a trained professional. So please call the office. We can easily schedule you for a free consultation to at least get the area evaluated, looked at, and perhaps even getting an MRI.
Yeah, and would you say that these silicone injections patients, it's reached like an epidemic level?
I would say so. I mean, so many patients have had stuff injected over the years, and now it's just becoming a breaking point, if you will, where there are just so many patients coming out with major, major problems.
And we have celebrities speaking out about this, and it's also so important that they do, because it teaches us that, you know, not everything we see is the truth. And there's a lot of I mean, it's dangerous and it's life-threatening. Yeah,
so I mean, don't do it. I mean, just think about it. I mean, just do your research. If your research says get silicone injections, you need to do more research, because silicone injections are not a good idea. Yeah. I mean, again, listen to medical professionals that are treating patients who have had complications of this stuff, not your influencer.
Right, and another thing is that if they say they're injecting medical grade silicone, probably not, right? You want to talk about the price point of that?
So medical grade silicone, the only place we use medical grade silicone is for a very rare treatment of the eyeball. It's when we're repairing the retina, and we place a small drop about that big inside the eyeball. You got to sit face down, and that piece of oil that's injected in the eyeball uses gravity and relocates the lens. Okay, very, very complicated. That little drop of silicone costs thousands of dollars. That little drop.
Wow.
So think about, okay, what you're paying for the injections. I don't know, a couple $100, $1,000, $5,000. If one drop is $1,000 minimum medical grade, there's no way what they're injecting is only X price.
No way.
And the other thing is, there's no way they can get a hold of it either. It's regulated. So, you know, if they say they're a nurse or a doctor and, oh yeah, this is safe, it's not, I promise you.
One more thing that I think we really have to stress is if you are scrolling through TikTok, Instagram, YouTube, and you see people promoting silicone injections, they're also called butt shots. People are asking, oh, who's your pumper? I want to get some of this. I think as a community who's educated in silicone injections, we have to say something.
Yeah.
Because if we could prevent even like one person from getting these shots and potentially ruining their lives, that's major. That's so important.
Yeah, absolutely. Absolutely.
A viewer said, just get a BBL by a board certified doctor so you can avoid all of this.
Exactly. So, I mean, there are other ways to get a bigger buttock. BBL, fat transfer, Brazilian butt lift, where we take fat from one body part, tummy, hips, backside, and we purify it and transplant it to the buttock. That's a really good option. Option number 2, buttock implants, FDA approved, very, very safe procedure if done correctly by an experienced board certified plastic surgeon. And number 3, Sculptra, very safe, good material to inject, again, FDA approved. We can build the buttock that way too.
And Sculptra is the only injection that you would?
Correct, that lasts. Okay, there are other injections, other fillers, Juvederm, Restylane, Voluma, etc., but those only last maybe 18 to 36 months, and then you got to spend that fortune again to re-inject the buttock.
I see. Any other questions from the audience?
One is just asking if they want to learn more about this, where can they go?
Yeah, so you can follow us live on Instagram. We always have live feeds in the operating room. You can go on YouTube. You can see a lot of our videos there.
Yeah, we do a lot of videos on YouTube where you could also see us cutting into the specimen after Dr. Katzen removes it, either from the buttocks, the lips, wherever it might be, and you could actually see the silicone balls in there that you call bobas, and you'll see as he cuts into them, they explode with the silicone, because that's what happens. Thank you guys for your questions. We're just going to end our podcast off now. If there's any more questions, please message us on Instagram. We're very responsive on there. It's Dr. Katzen MD. Yeah, Dr. Katzen MD.
Okay.
Yeah, and once again, we are offering free consults for silicone injections patients anywhere in the body for the month of February, because we know how important it is and we just want you to get it out.
But thanks for watching us. Please watch us on all these other podcasts we do, and we have a lot of topics to cover in this plastic surgery world, and hopefully we can get all your questions answered and see you soon.
And once again, if you're watching this, please educate others on silicone injections, because not everyone knows.
Yep.
All right.
Thanks.
Thank you guys. Thanks for joining us. Bye-bye.
Bye-bye.